Thanks for coming to this press conference. We all know that seniors are at a significantly increased risk of severe disease if they are infected with COVID-19. Globally, about 80% of COVID-19 deaths occurred in those older than 60 years old. In Singapore, we see the same trends. Our death rates from COVID-19 are low, but among these, those 60 and above account for the vast majority. 90% of all COVID deaths here are seniors. Nearly 1 in 6 seniors developed severe symptoms and needed intensive care in the hospital. It is therefore critical that we make extra efforts to protect our seniors. Even as we cautiously lift some circuit breaker measures, we will continue to put in place enhanced safeguards where necessary, especially for vulnerable groups like our seniors. We have not seen widespread COVID-19 outbreaks in our nursing homes locally, but we cannot let our guards down. Since January this year, the Ministry of Health and the Agency for Integrated Care, AIC, have worked with the nursing homes on a range of safeguards. As a further precautionary measure, homes serving the elderly have arranged for client-facing staff to stay at designated accommodation facilities on-site or at hotels during the circuit breaker period. About 2,600 nursing home staff are in the process of moving into hotels. I would like to thank the affected staff for their understanding for the inconveniences they undoubtedly have to face to keep our seniors safe. Testing is an important strategy to detect COVID-19 infections amongst our vulnerable groups as early as possible to limit further transmission. We will test all staff and residents of nursing homes with symptoms of acute respiratory infection. New residents are also tested prior to admission. In addition, since 29th April, we have initiated testing for all 9,000 staff and 16,000 residents of the 80 nursing homes in Singapore. Of the 9,000 staff tested, all were negative for COVID-19 except for one staff in Ren Ci AMK. We have tested more than 30 residents who could be in contact with the staff, as well as those who have acute respiratory symptoms. Their tests are negative. Ren Ci will continue to monitor them. We will progressively test all 16,000 nursing home residents, and we expect to complete this by early June. We expect that more cases will be identified within our nursing homes with this extensive testing in progress. Where there is a positive case, Ministry of Health and AIC will support the nursing home to thoroughly disinfect the affected areas, conduct contact tracing, and quarantine close contacts. Minister Desmond Lee will share more about what is being done in other residential care homes serving the elderly. Beyond nursing homes, we also want to take good care of our seniors in the community and give them a helping hand during this circuit breaker period. Safe distancing does not mean social isolation for our seniors. The Civil Generation Office has proactively checked in on our seniors with weak family support and referred them to relevant support services, including befriending where necessary. I'm also happy to know that many of our seniors are staying in touch with their family members and friends through phone and video calls. Many have also taken to social media to stay in touch. Since 5th of May 2020, some 130 traditional Chinese medicine medical halls with registered TCM practitioners have been allowed to sell retail products on top of the consultation and herbal dispensary services which they were already allowed to provide. We have received feedback from some seniors that they purchase medicine also from TCM medical halls and find it inconvenient if they have to travel far to these halls. A Member of Parliament, Lee Bee-Hua, also raised this issue in Parliament this week, and I had promised her that I would take her feedback seriously. Indeed, I have asked the Ministry of Health to do a review, and I'm happy to share that from 12th May, all TCM medical halls will be allowed to sell retail products. This will provide more convenience, especially to our seniors. However, the medical halls must put in place the necessary safe management measures before commencing operations, as they serve many seniors. Let us work together to keep our seniors safe. Let us keep up our good habits, such as safe distancing, personal hygiene, and wearing of masks. Avoid interacting with seniors if you're unwell. Together, we can protect them from the infection. Let me say a few words in Mandarin. 我们都知道，年长者一旦感染冠状病毒，比其他的人可能病情会较严重。全球至今因冠病病逝的人当中，至少80%的年龄超过60岁。本地的趋势也一样，所以我们需要采取额外的措施来保护我们当中的年长者。接着下来的几个星期，我们在谨慎的解除一些阻断措施的时候，还是会在必要的时候加强一些对年长者的防范措施。本地的疗养院至今没有出现大规模的疫情爆发情况，但我们不能掉以轻心。从今年1月开始，卫生部和互联中心 AIC 与本地的疗养院合作，已经实施了一系列的防范措施。我们将实施额外的防范措施。疗养院已经安排那些在工作上会接触到疗养院住户的员工，在这段时间住进一些特定的酒店。目前大约有2600名员工已经陆续的住进酒店。我要在这里感谢这些员工，为了保护我们的年长者，他们做出了一些牺牲，在生活上也造成一些不便。要确保病毒不会进一步的传播，检测是一个非常重要的对策，能让我们尽早的测出弱势群体里面有没有人染病。所有的疗养院员工和住户，如果出现急性呼吸道疾病的症状，我们都会进行病毒检测。新住户在搬进疗养院之前也会接受检测。从4月29号开始，我们已经开始对本地80家疗养院的9000名员工以及16000名住户进行检测。完成检测的9000名员工当中，除了1名在仁慈红帽桥疗养院工作的员工，其他员工检测的结果都呈阴性。我们也已经检测了超过30名可能与这个员工有过接触的住户和员工，以及有急性呼吸道症状的住户，他们的检测结果也都是阴性的。仁慈疗养院会继续观察他们的情况。我们也将会逐步检测所有16000名的住户，预计能在6月初完成检测的工作。因为我们大规模的进行检测，我们预料接下来或会有更多疗养院的病例出现。李志胜部长接着下来会讲解更多在其他疗养院的养老院的行动。除了疗养院，我们也必须好好的照顾在社区里的年长者，在阻断措施实行的这个期间，向他们伸出援手。关爱乐龄办事处 AIC SGO 也已经积极的联系了一些缺乏家庭支持、需要帮助的年长者，来帮助他们向一些机构团队求助，包括寻找友伴等。大约有130家有注册的中医坐诊的中药行，从这个星期二5月5号开始，已经被允许售卖零售商品。这些中药行之前已经被准许提供问诊和配药服务。有些年长者回馈说，他们需要到中药行买中药，如果要长途跋涉到别的地方购买，会很麻烦。李美花议员星期二也在国会提出这个情况，我当时向他保证，我会认真的看待他的建议。我和卫生部的同事也已经检讨了这个情况，我想我们可以进一步的放宽。所有中药行从5月12日开始， 可以允许售卖零售商品，但是由于这些中药行服务很多的年长者，所以在他们实行开始售卖之前，必须实行有必要的安全措施，做好十足的准备。保护年长者的安全，人人有责。只要我们齐心努力，就能够保护我们当中的弱势群体。Now, I would like to invite Director of Medical Services to give an update on the medical situation.
Thank you, Minister. As of the 8th of May, 2020, 12 noon, the Ministry of Health has preliminarily confirmed an additional 768 cases of COVID-19 infection in Singapore, and the vast majority of these are work permit holders residing in foreign worker dormitories. 10 cases are Singaporeans or permanent residents. We're still working through the rest of the details of the cases, and further information will be provided via the press release that the Ministry of Health will issue later tonight.
I would like to invite Minister Desmond Lee to give an update.
Good afternoon. Mr. Gan had reiterated seniors in the community as well as seniors in our residential facilities are most at risk because if infected with COVID-19, tend to fare poorly. We've therefore been paying extra attention to seniors because of this higher risk of developing serious health complications if infected. And it is therefore important for seniors to try to stay home as much as possible. Younger members of the family should help out by arranging for grocery shopping and running of errands for seniors. If you don't live with your parents, you can arrange for contactless grocery delivery, or you can buy for them and leave it at the door without putting them at risk through interaction with them. You can also take care of their emotional and mental well-being by calling our seniors often and keeping in touch with them. Let me give an update on seniors living in residential homes, as well as vulnerable seniors and isolated seniors. Let me start off with seniors living in residential homes under MSF's charge. Since late January, we've been tightening precautionary measures to strengthen the protection of seniors living in residential and community-based facilities. These include welfare homes, sheltered homes, and adult disability homes, amongst others. MSF completed a proactive swabbing of 4,600 staff and residents of some 34 homes that are funded by MSF on the 2nd of May 2020. 3,250 of these are residents and 1,300 of them are staff. Thus far, most of the returns have come back and they've been negative. These homes have not allowed visitors since the 3rd of April, when we tightened precautionary measures for everyone's safety, part of the enhanced circuit breaker measures. And to further reduce the risk of virus infection into residential homes for seniors, we have arranged for all care staff to either move on site into the homes or to stay in designated hotels. And this is to minimize their community social interactions and reduce the risk posed to our care staff, therefore reduce the risk to residential homes. About 700 staff working in MSF-funded residential homes will live on-site in the facilities, and about 400 will move to hotels. The movement of staff started on the 4th of May, Monday, and will complete by next Monday, the 11th of May. Like Minister Gan, I'm deeply appreciative to the staff of the residential homes for this big sacrifice, for staying away from family, and for putting the well-being and welfare of the senior residents above their own. And just as what our homes have been doing since January, any staff or resident who displays symptoms will be immediately isolated, given medical attention. Now, on the 27th of April, MOH announced that there was a cluster of 15 positive COVID cases at Acacia Home, which is a welfare home run by Satya Sai Social Services and funded by MSF. 13 of them are residents and 2 of them are staff. One resident has since fully recovered and has returned to Acacia Home. Today, one of the residents on quarantine had just been tested positive for COVID-19. And this is near the tail end of the 14-day. We have tested everyone else living in Acacia Home and working at the home, including contractors who have been there for essential purposes in the past 4 weeks. And those who tested negative are now under quarantine orders and their health is being monitored closely. So that is regarding seniors living in residential homes. Let me now move to the broader support for seniors living in the community, in particular seniors who are vulnerable and seniors who are isolated. Now, since the circuit breaker began, the National Council of Social Service has coordinated with volunteer groups and ground-up community partners to ensure that essential aid continues to be provided to those in need, including vulnerable seniors, while minimizing movement and interaction of people on the ground. This network has been distributing meals, surgical masks, disinfectants, sanitizers, exercise bands, telecommunication equipment, SIM cards, and so on. And through these distributions, the volunteers take the opportunity to guide seniors on the necessary precautions that need to be taken, such as frequent hand washing, and checking if the seniors need any other assistance, such as transport to their medical appointments. During the extended circuit breaker period, we have worked with several social service agencies to partner government departments such as HDB and LTA to undertake joint safe distancing patrols. So if they encounter seniors who are out and about, they will guide them to wear a mask, stay at home as much as possible. Should our safe distancing ambassadors and enforcement officers identify seniors who may require further assistance because they may have some underlying issues that prevent them from staying at home, or if they have mental health issues, they'll be referred to the relevant agencies for further support, including to AIC for follow-up. For those seniors who are homeless and rough sleeping, under the Peers Network, our partner agencies will refer them to safe, sound sleeping places for shelter, offer help and assistance to them. MSF will work with the relevant agencies to look at their housing issues going forward. Minister Gan spoke briefly about agencies' efforts to keep in touch with seniors to ensure that while they may live alone, they are not isolated. Let me give a little bit more detail on those efforts. The Silver Generation Office, or SGO, has been calling vulnerable seniors to ensure that they're informed of the latest developments and also to check in on their well-being and on their needs. They've reached out in this way to about 19,000 seniors living alone and will continue to regularly call to support them. These include seniors who live alone with weak social support, as well as empty nesters with weak social and family support. The seniors who were engaged in this way were receptive. Most seniors expressed that they were coping well with the current situation, but some expressed concern and uncertainty about the COVID-19 pandemic. And following up from these calls, SGO is working with some 450 public service volunteers to run errands for these seniors who require assistance outside the home during this period. And some 1,200 seniors have requested for assistance and are being helped in this way for meal deliveries, financial assistance, and befriending services. It's important that our seniors are updated and are aware of what is going on. So if you or any other community group knows of any senior in your neighborhood who could use with a friendly check-in every now and then, please do reach out to them or let us know. The hotline for the Agency for Integrated Care is 1-800-650-6060. And for those who may need psychological and emotional support, the 24-hour National Care Hotline is 1-800-202-6868. This hotline is manned by professionals, including psychologists, counselors, public service officers, trained in psychological first aid. And when I spoke to some of the care hotline officers earlier today, they shared with me that some seniors called, expressed concern about the ongoing situation and needed help through befriending. There are also other activities, such as on television and online, that can help our seniors keep engaged and active, such as the National Silver Academy courses online and the Health Promotion Board exercises, which are online. I encourage family members, especially younger family members, to ensure that this is set up and available to our seniors. MOH, MSF, AIC, and the National Council of Social Service, as well as our many community partners, will continue to coordinate efforts across the health, social, and community care sectors to ensure that our seniors and the vulnerable, both in the community and in our residential facilities, receive the necessary support and assistance with appropriate safe distancing measures put in place. Together, we can emerge from this crisis, take care of all our seniors.
Good evening, everyone. Let me just wrap up by giving an update on where we are in this crisis. We are continuing to fight the virus on two major fronts, as we have described. Firstly, in controlling the outbreak in the migrant worker dormitories, and secondly, to control the outbreak in the broader community. For the migrant worker dormitories, the situation in the purpose-built dormitories is stabilizing, but we are still taking time to clear the many other dormitories we have in Singapore, especially the smaller factory-converted dormitories. So each day, the numbers are still high, partly because of our active and aggressive testing regime, which we have put in place, and we are continuing to test more migrant workers every day. So we expect to still see these numbers for a few more weeks before they stabilize. But our strategy is working, and we are making progress day by day in clearing these dormitories. We are also very mindful of the people who are working in the dormitories and also the community care facilities. In recent days, we have picked up a few cases of people working in these settings who have become infected. And so we are not only, we already have precautions in these settings, but we are doing more now by also testing the workers who are working in these settings, not just once, but again, periodically, just to ensure that these workers can do their work in a safe environment. At the community level, you know the numbers that we have been reporting every day. They have been coming down. I think the average in the past week was about 10 a day. The number of unlinked cases have also come down. And importantly, if you look at the surveillance program which we have put in place to test cases in our clinics with prolonged acute respiratory illness, those number of cases have also been coming down, which suggests that the number of unlinked cases in our community is lower than it used to be in the recent weeks. So we are making progress because of the circuit breaker, and we should continue to do our part to comply with the measures for the rest of the circuit breaker period. We should remain vigilant and not take any chances. All of you would know that we have made some announcements on some easing of measures from the 12th of May onwards, but that should not be an opportunity for us to go out and more frequently. Right? For the businesses themselves, first of all, do not be in a rush to reopen your business and neglect the important safe management practices that you have to put in place first. In fact, if the safe management practices are not ready, then please do not just rush to reopen the business on the 12th of May, because our inspectors will be going around to check and to enforce. And if you are not ready, if the business premise doesn't have the necessary precautions and safeguards in place, then we may have to ask you to stop work anyway, and there will be penalties imposed. For individuals, again, there is no need to rush to go out to patronize these businesses on the 12th of May. I know some people may not have had a haircut for some time, but there is no need to rush to go out to have a haircut on the 12th of May. There will be time to do so, right? So let's pace ourselves. Don't rush to go out quickly just because of the easing of some restrictions. The circuit breaker is still in place, and we should make the most of this next 3 weeks and more through the circuit breaker period to bring our community numbers down as much as possible. In the meantime, let us also, as we are focusing on today, in today's press conference, do everything we can to protect our seniors because they are the most vulnerable group. So if you are living with an elderly person in the same household, then encourage that person not to go out and try to run errands on their behalf. If you are not living together, but your parents or grandparents are living separately from you, then make use of this opportunity to stay in touch with them remotely, call them. A physical separation doesn't mean that they have to be emotionally isolated. Mother's Day is coming on Sunday, for example. So remember to call your mother, your grandmother, and use this opportunity to be in touch with them. Don't visit them because that would be an activity that we don't want to encourage, because whenever you visit, have physical contact, that can bring some risk to the elderly. But do call them, check on them regularly, and continue to show our appreciation to our seniors, because we all know that during this circuit breaker period, many of them do feel isolated because they are away from their children and grandchildren. So we, as I said just now, have about three over weeks before the circuit breaker period comes to an end on the 1st of June. We will, as we have described, continue to monitor, assess the situation in thinking about what to do post 1st June. Whatever the decision or whatever happens in the coming days or weeks, it is clearly not going to be the case that after 1st of June, everything will be lifted and we will go back to status quo ante. That is clearly not going to happen. So all of us have to be mentally prepared that the scenario of post 1st June will continue to be one of gradual, calibrated easing. Exactly how much we'll have to see depending on the assessment of the situation in the coming days and weeks. And as we assess that and are ready, we will let Singaporeans know more details about how we can, about the exact nature of the restrictions or the easing that one can expect post 1st June. But in the meantime, like I said earlier, let us continue to hunker down and do everything we can to stay home, minimize our contacts with others, and make the most of the circuit breaker period. Thank you.